My name is Ashlee Tackmann. I'm a physician assistant in orthopedic surgery with Mayo Clinic Health System. Physician assistant is a really growing profession. It allowed me to fulfill my goals in medicine while also maintaining my family life at home. So I always tell people I have goals in medicine and I have personal life goals, and I'm able to do both. I enjoy orthopedic surgery because I really enjoy the mix of the time I get in the clinic seeing and talking to patients, and I really enjoy being in the operating room as well. Seeing patients from when they first come to me with knee pain, kind of seeing them through all aspects of their care, I think is one of my favorites about working in a specialty. Seeing the functionality that's restored kind of from start to finish. If somebody, whether or not they have surgery, but just through their treatment plan, if we can get them back to an increased quality of life and functionality that they had before, is a really, really great thing to see. My patient care philosophy is one that's very patient-centered and patient-focused. I think it's important for patients to be involved in every aspect of their care. A lot of times a patient will look to us for answers and decisions, and I think it's an important part of my job to provide those options for patients, but together, along with that patient and myself, we can come up with the best treatment plan for them. I would describe myself to a new patient as friendly, hopefully very approachable, confident in what I do, knowledgeable, but most important, hopefully providing a comfort level with the patient. So again, they feel confident in what I'm doing and feel like they can be a big aspect of their care. I think us as a team offer a very skilled set of providers. I think we really do a nice job of respecting patients and their decisions and how they want to be involved in their care. I think it's really important to stress to a patient that this is something that we do every day. And for me as a patient, I'd want that knowledge in a provider, that they're confident in what they do and it's a very routine aspect of what they do. I think we can really acknowledge that when a patient comes in with a complaint, we know it's a big deal. And having surgery is a big deal, and it can be life-changing, life-altering for some. It can help restore functionality, but again, it is something, this is why we're here. We do this on a regular basis, and to have that confidence in us as a team, I think is so important. Patients can get the most from their healthcare by coming into an appointment, kind of having an idea of what they'd like to get out of that appointment. Some patients will come in and they kind of just want to know what's wrong and know that they can continue doing an activity. They're not going to make anything worse. Others like to know what options they have for treatment. So I think it's very important for patients to be involved in their care. Come in with a list of questions, again, kind of what you're hoping to gain by this appointment. And again, together we can make decisions on how to go forward. The thing I like most about working for Mayo Clinic Health System is the fact that we can provide really excellent care to our local community. I think that's an important part of what we do here in the surrounding area, providing care to our patients that we see every day, that we see at the grocery store, that we see kind of out and about, and not just here at the clinic. I also like the connection that we do have to Mayo Clinic Rochester. I think that's a great resource for us. We try to handle what we can here, and anything that we think needs the resources that Rochester has to offer, we have that connection. Outside of work, I like to spend time with my husband and my children. I like to run, I like to exercise, I like to attempt baking. I have close friends and family in the area that we like to spend a lot of time with, and just my kids' activities, coaching, and just being a part of their lives.